Kristen Thomas. I'm going to talk a little bit about my nursing career prior to school nursing and then what brought me to school nursing. I'm a fairly young school nurse. I think maybe one of the youngest in the district. This will be my third year in school nursing. But I started my nursing career as a nurse in the intensive care unit, the adult intensive care unit. I did that for about 9 months and decided that kids were my passion. I'd rather work with the kiddos. And so I trained into the pediatric intensive care unit and worked there for 2 years. When my husband and I moved to Tucson for his career, I decided to switch directions and get into school nursing. And the reason that I made that decision is because when I was working in the intensive care unit, whether it was with adults or with kids, was that I felt that I was working with these patients after all of the damage had already been done. They were at the point where they were so sick that the likelihood of them recovering and living a normal life from that point forward was not very good. And I would rather be able to intervene at some point in their life before that happened and hopefully make a difference, even if that was just in one patient's life throughout my entire career, that I could prevent them from ending up in that ICU bed and from changing their life forever. I don't want to say ruining their life forever, but really impacting their life negatively. I would rather intervene in a place where I could educate them, prevent those things from happening, and I felt like school nursing is where I could turn to be able to make that difference. So that's why I'm here. So today I'm going to talk to you more about special needs nursing in the school setting. In Sunnyside, I'm the preschool nurse. We added kindergarten and first grade to Ocotillo this year, so early childhood nurse. And I'm also the special needs resource nurse. So I help the nurses throughout the district if they have questions about taking care of kids that have special health care needs. So experts agree that the number of students with chronic medical needs is increasing in school districts around the nation. So medical technological advances have allowed for babies that are born with chronic medical conditions, genetic abnormalities, to survive. And so we're seeing them in the school districts when normally they wouldn't have survived and we wouldn't have seen them here. We're seeing obesity is on the increase, high sugar diets, which leads to diabetes. And we're seeing an increase in asthma for various reasons. All right, so when we talk about special needs students in the school districts, we do need to talk about what the law says about that. And there are 3 acts that basically tell us that students should be allowed to participate in the least restrictive environment in the school setting, regardless of their healthcare needs. Those acts are the Rehabilitation Act of 1973, and that's in Section 504, the Individuals with Disabilities Education Act, and the Americans with Disabilities Act. So what type of students are we talking about? We're talking about students that might require an insulin injection to control their diabetes. Maybe they need a medication to avert a life-threatening allergic reaction. Students with hearing loss who might benefit from classroom and environmental changes. A student who takes a daily medication for emotional or behavioral disorders such as ADHD. Or a student who receives nutritional support in the form of a G-tube feeding. All right, so we're going to talk numbers. I think you guys will be amazed to hear the number of students that we see in our offices and the number of students that we have in the district that have special health care needs. This data actually comes from the spring of last school year. I didn't have up-to-date data by the time I sat down to look at this last night, and I thought, well, it's too late. So last year, by the end of February, school nurses had seen about 33,000 students in their offices. We had dispensed 20,000 medications. We had given over 3,000 as-needed medications. We had performed 8,000 hearing screenings, a little over 6,000 vision screenings. We had done close to 5,000 calculations on insulin. And we had contacted parents about 10,000 times from our offices. So it's quite the job. At Ocotillo Learning Center, and again, this was in the spring of last school year, we had 39 students with life-threatening allergies. And of those 39 students, only 8 of them kept EpiPens at school. We had 20 students with seizure disorders, and 4 of them had diastat kits. 46 students with asthma. In the school district, about 10% of students have asthma. 20 of those students had their own inhaler, so less than half. 6 students at Ocotillo had G-tubes, and 2 of those were receiving G-tube feedings at school during the school day. 1 student had a tracheostomy, and that student would get tracheostomy cares at school. Another student had severe stridor that required oral suctioning throughout the day. 1 student with type 1 diabetes, a 3-year-old. And 10 students with documented hearing loss that required interventions in the classroom to make sure that they could hear the teacher and participate in class. So if you think about, I know Terry talked about, what the school nurse does, and that we aren't putting Band-Aids on all day long, as many people I think that's what we're doing. And think about all of these students. This is case managing me. I'm the nurse here at Ocotillo. All of these students. It's a big job. Jody talked about the demographics of our population, and I just wanted to cover, I think that it's important to think about how population demographics affect the healthcare needs of the students that we care for, and why that is important. Why it is important for us to have a school nurse, a registered nurse in every school building. So if you think about families living in poverty, we think about things like their access to health care. So if you can't afford to go to the doctor, or maybe you don't have health insurance, or maybe you're afraid to apply for health insurance because you're an illegal immigrant, where are you going to turn for your healthcare needs? And if you have special healthcare needs, such as asthma or diabetes, who's going to manage your care every day? And if the only medical professional that you see all day long is the school nurse, then that ends up being the person that you go to for that medical care and for that advice. And that's why it's so important to have registered nurses in every school building. Again, education. If you think about our demographics, a lot of these families had maybe not even graduated from high school, most likely don't have a college education. And how does that affect the way that they're able to interpret the medical needs of their children? The school nurse plays a vital role in educating the family, being able to reach them on that level that they understand. Poverty affects the families in other ways, such as housing and transportation. A student with asthma that lives in public housing that's full of dust, mold, cockroaches, how does that affect the way that they're able to manage their asthma? Okay, so these are all things that we have to think about. Terry talked a little bit about the interdisciplinary team that we work with as school nurses, and I just wanted to get an idea of what types of interdisciplinary professionals you guys think that we work with in the schools. Audiologists. Uh-huh. Others? Optometrists. Mm-hmm.
Speech therapy.
Yep, speech therapy. The district employs occupational therapists, physical therapists. We work with school psychologists. We work with, part of our interdisciplinary team are the teachers, the educators. Sometimes the teachers are the best way to reach the students, but in order to get the information across, they need education from us. Administrators, we need a lot of administrative support in order to do the things that we need to be able to do to care for the students. Bus drivers is another one. students with life-threatening illnesses, or not even life-threatening, but chronic illnesses that ride the school bus. Food services, students that have food allergies, students with diabetes. We're communicating a lot with the primary care providers, with the pediatric specialists. We're sending paperwork back and forth, and I'm going to talk more about what that paperwork entails. So some chronic health conditions that we see in schools: cerebral palsy, Down syndrome, epilepsy and seizure disorders, spina bifida, orthopedic disorders, hydrocephaly, maybe with a shunt, immunological disorders and cancer, diabetes, asthma and life-threatening allergies, mental and behavioral health disorders such as ADHD, ADD, and autism, and other genetic abnormalities. Some specialized health care that we provide in schools include gastrostomy feedings, catheterization, ostomy care, suctioning, tracheostomy care, ventilator management, central line management, seizure management, blood sugar and insulin management, pain management. I bring all these things up because sometimes when you think of school nursing, you don't think that you're doing a lot of the things these skills that you're obtaining when you're doing your clinicals in the hospital, that you're not going to use those if you go into school nursing. But we actually use those skills. Myself, I use them on an everyday basis. Also important to note is that I use them, it's just me. When you're in the hospital, there's a lot of other people that you can turn to. If you have questions about respiratory management, you can turn to the respiratory therapist. If you have questions about insulin management, you can turn to the diabetes educator. But here it's just me. And so that's actually been a really fun part of the job for me. It's been something that has challenged me in a way that I haven't been challenged in other roles as a nurse, because I've had to really learn to be an expert in all of these things. All right, so we're just going to go through a few diagnoses just so we can use our critical thinking skills. I like to kind of still think of it as like when you're writing a nursing care plan, and what's your assessment, what's your desired outcome, what's your intervention, and then how are you going to evaluate the results or the outcome. So if you had a student that you knew was going to be newly enrolled and they had cerebral palsy, what would be your assessment? What would be the things that you would think about as far as how you would care for that student once they started in the classroom, when you're thinking about their diagnoses? So a child with cerebral palsy maybe has difficulty with ambulation. So you're going to think about if they're riding the school bus, how are they going to get on the school bus? And when they get to school, how are they going to get off the school bus? And how are they going to maneuver in the classroom? Has their cerebral palsy affected their diaphragm and their ability to breathe? The student that I talked about that had severe stridor had cerebral palsy, so she was requiring suctioning throughout the day just to be able to be in school and participate. G-tube feedings, are they able to eat orally, or do they require a G-tube feeding? If they can't eat orally, what kind of diet do they require? How are we going to provide that diet to them in school? The cafeteria actually does that for them. They blend their foods, which I had never thought about something like that when I first was coming into school nursing. But we provide all of those things that happen in the hospital in the school. And so what's your desired outcome? Well, your desired outcome is that that student can participate in the classroom alongside their peers to the best of their ability, hopefully equal to their peers. So an example that I give is if my student with cerebral palsy requires G-tube feedings, is it very fair if they have to leave the classroom for half an hour and come to my office for a G-tube feeding? Does that make them very much like their peers? No. So how are we going to make sure that they get their G-tube feeding in the classroom at lunchtime with the rest of the students? Because it's important to kids to be involved in that social environment, psychologically important to them. I had a student this year whose classroom teacher and staff didn't feel very comfortable with having the G-tube feeding done in the classroom. And so it was a slow process convincing them and getting them to the point and the place where they felt comfortable with that idea. And once they started doing that, and the student stayed in the classroom at lunchtime for his G-tube feedings, he started talking. He had never talked before. So that social interaction with his peers was really important. And then there's a lot of things that we do. These are the interventions or the actions that take place after we've assessed the situation, we've thought of what our desired outcome is. We have to get a health history from the parents, sometimes from the doctor. We have to create an action plan for that student. So that outlines what we're going to do with them, maybe in an emergency situation or maybe on a day-by-day basis, and it has to be something that's understandable to the parents and the teaching staff as well. Physician's orders. So even though we don't have physicians on staff, we still operate under physician's orders. So I don't give a medication without a physician's order, and I don't give a G-tube feeding without a physician's order, and I don't do trach sectioning without a physician's order. So that's that communication that I'm talking about that we're always making with doctors' offices. Have you guys worked with case managers a lot when you're doing your clinicals in the hospital? No? If you ever get the opportunity to, when you're doing your clinicals, spend the day with the case manager, they do a lot of this sort of thing too. They're managing a case of patients in the hospital, trying to figure out how that patient is going to live their day-by-day life and get the services that they need and have the orders that they need for the home health care nurses and such. We do those things in the school too as school nurses. It's much like a case management role. We still create care plans, individual health care plans for students. The IEP, are you guys familiar with what an IEP is? It's an individual education plan for students that have special healthcare needs or special learning needs. In order for them to have an IEP, they have to pass a vision and hearing screening. So we're doing a lot of screening, meeting deadlines that has to be done in time for the IEP to be renewed each year. It's a federal law for them to be allowed to have an IEP if they need that. Okay, so Down syndrome. Sometimes my students with Down syndrome have had open heart surgery over the summer, and so when they come back to school, we have to think about, especially if they're riding the bus, how are we picking them up? Are we educating the staff that we can't be picking them up from under the arms to get them off the bus and bring them into the classroom, things like that. Students with Down syndrome also have more vision and hearing problems. We think about their language development and how we're going to facilitate those types of things for them in the classroom. So essentially, I gave you several examples, but it's essentially the same for each student that comes in, whether it's tracheostomy care, whether it's G-tube feedings. It's the big picture is that it's important to critically think about the needs of that student so that you can meet those needs when they're in the classroom. Okay, delegation. So we talk a lot about delegation in nursing school, right? I feel like I had several exam questions about delegation, what's appropriate delegation. And we still think about that in the school setting too. So who can perform a special needs procedure in the school setting? What do you guys think? Me? Yeah. I'm one person, but actually that can also be performed by, depending on what the procedure is, can also be performed by classroom personnel. And so we oversee the education of the classroom personnel as they learn to perform those procedures. So I had a student last school year, I mentioned with the trach that required trach sectioning, and eventually his teacher learned to suction him. And she suctioned him throughout the day. And it was nice for him because he didn't have to come to the nurse's office again, like I said, every time that he needed to be suctioned. He wasn't missing as much class time. Who can administer medications in the school setting? Again, the school nurse can administer medications with a physician's order. but also school staff can be trained to administer medications, so can a health aide or a health clerk. So again, you're delegating, you have to be responsible for overseeing the delegation of that task to unlicensed personnel. And then I added the emergency epinephrine because that was new last year, and that the state legislature decided that all schools may have a program where we keep EpiPens on stock. Maslow's hierarchy, are you guys familiar with that? It was always helpful to me when I was in nursing school and as I've progressed in my nursing career to think about the care of a patient in that way. And I think that it's especially helpful in school nursing and public health nursing, or thinking about the health of a person even outside of the hospital setting. Because number one, in the schools and in life, as nurses, when we're caring for our patients, we want to make sure that the student or the patient is safe. That's number one. And then once we've decided that we can have that student in the classroom, we can care for that student in the school environment, and it is safe for them, then, like we talked about earlier, is the learning environment optimal for that student so that they can learn and develop, regardless of their health-related barriers. So you kind of move up the pyramid. Okay, so why should you care about school health nursing? Why should you care about public health nursing? And Terry mentioned this too. It's because healthy people or a healthy society, they have more opportunities. And in our case, those opportunities are obtaining an education. So if they're healthy, they can become better educated. And the end result is a more productive and successful person, a more productive and successful society. And that's the kind of society that we all want to live in. And so I think that when you go into public health nursing, when you go into school nursing, you have the ability to really change your world in that way. And I think that's very special.